Hi, I'm Dr. Craig Castanet of Backstrong Clinic. I want to talk to you about chiropractic treatment today. Chiropractic treatment, as you may be familiar with, generally involves the manipulation or adjusting of joints of the spine to help you with neck and back pain. At Backstrong, we don't do a lot of manipulation. We do some mobilization and some manipulation, and we do some manual therapy. These are all related in some ways. But for the approach of neck and back pain, very often we use a different approach, and we use spinal decompression for most people with neck and back pain. The reason is that in my 26 years clinical experience, 18 of which were at an orthopedic, physical medicine, and physical therapy practice, as well as my last 3 years in a neurosurgical practice, spending time there and working closely with pain management over the years, my clinical experience has found that spinal decompression treatment has been a more effective means of treatment for most of the common neck and back problems that plague people. The reason is that fundamentally the reason people have neck and back pain is because with time, gravity, and influence by your genetics, there is a progressive degenerative compression of your spine that includes the neck and the low back. This starts with a change in the status of your discs in the neck and back. Over time, discs in the neck and back lose water content, they wear out, they lose height, then you result in more compression of the joints. Let me show you for a moment here. This, for example, is supposed to represent a young and normal and healthy disc, and the discs are cushions between the bones. When you're young like this, you start to experience wear and tear of the disc and loss of water content. These happen initially on a microscopic level. Oftentimes, when it's early in the process, these problems respond fine to manipulation and other mobilization, etc. That may also work even when you're older, but it's much less likely to work optimally when you're older and have acquired some degenerative changes. When we are older, the spine looks a little more like this. This represents actually quite a degenerated disc. There's loss of water content here. There's bony overgrowth here. There's enlargement of the bone. The joints don't move so much here. The disc status is quite bad here. Oftentimes you can't even adjust people like this because there's not a lot of joint play. In any case, even at a younger age, I find conceptually and clinically a more effective approach to treatment of most people is to include spinal decompression treatment, even for chiropractic patients. Spinal decompression treatment works by having the person lie on the table. You secure them to the table, and it very gently separates the vertebrae. That helps with all the potential pain generators in the neck or back, meaning it helps the status of the disc, the nerve, and the joint. By separating them, we know that we get more water, oxygen, and nutrients in here. That improves the environment for the cells within the disc. The cells, when they're in a better cellular environment, divide, create more discs, or more cells rather. Those cells in a better environment synthesize or make more of the molecules to repair the disc, and it's the disc generally that determines often the short-term status of the spine, but certainly the long-term status of the spine. The reason spines deteriorate starts with the disc, and treatments, even early on, should take advantage of the fact that addressing the health of the disc will make for a better, often short-term treatment outcome, and I think a better long-term outcome for the patient. So that's it. Thanks.